What if two ingredients already sitting in your kitchen could do more for your circulation and long-term vitality than most supplements on the market today? And what if most men over 50 are using one of them in a way that eliminates nearly half of its biological benefit without ever realizing it? Stay with me. In the next 10 minutes, I am going to show you exactly how to combine these two ingredients the right way, why timing matters more than most people think, and what is actually happening inside your blood vessels when you do this consistently. My name is Dr. Samra Turajilic. I specialize in neurology and men's vascular health, and I have spent years working with men in their 50s, 60s, and 70s. Men who were told that what they were experiencing was simply an unavoidable part of getting older. I am here today because I genuinely wish someone had told them otherwise far sooner. If you are serious about your long-term health, hit that like button, subscribe to this channel, and drop a comment below telling me where in the world you are watching from. Now, let us get into the science. I want you to picture a garden hose that has been sitting outside for 15 years. From the outside, it looks fine, but when you bend it, it no longer flexes the way it once did. And when you turn the water on, the pressure coming out the other end is noticeably weaker. That is essentially what happens to your blood vessels over time, and why it matters so deeply for how you feel, how you perform, and how long you truly thrive. In your 30s, your arteries are elastic, responsive, and highly efficient. The inner lining of your blood vessels, a single-cell thick layer called the endothelium, continuously produces a molecule called nitric oxide, which signals your vessel walls to relax, dilate, and allow blood to move through freely. This is the biological foundation of healthy circulation, and it governs your energy levels, physical stamina, cognitive sharpness, and sexual function. But beginning around your 40s and accelerating significantly through your 50s and 60s, a cascade of vascular changes occurs simultaneously. The endothelial cells that produce nitric oxide become progressively less efficient. Your artery walls lose elasticity. Oxidized LDL cholesterol and calcium deposits begin accumulating along vessel walls, narrowing the channels through which blood must travel. Here is the point every man needs to hear clearly. The blood vessels that supply certain areas of the male body are among the smallest in the entire circulatory system, sometimes just 1 to 2 millimeters in diameter. Even a modest reduction in flexibility or a subtle buildup along those walls produces a disproportionately significant drop in blood flow. This is the vascular reason, not some inevitable hormonal mystery, why so many men notice declining energy, reduced stamina, and changes in intimate function as they age. But here is what the science also tells us. Your vascular system is not fixed. It is a living, adaptable system with a well-documented capacity for repair when you give it the right inputs. Extra virgin olive oil is one of the most extensively studied foods in the world for cardiovascular health. The Mediterranean diet, researched rigorously for over 5 decades, uses it as its primary fat source, and the populations that follow this pattern consistently show superior arterial function and lower rates of cardiovascular disease well into their later decades. The primary driver is oleic acid, a monounsaturated fatty acid that makes up 70 to 80% of high-quality extra virgin olive oil. Research shows oleic acid supports healthy cholesterol ratios, reduces inflammatory signaling within blood vessel walls, and promotes arterial flexibility by integrating into cell membranes in ways that preserve their function. But what makes extra virgin olive oil truly remarkable are its polyphenols. Two of the most clinically significant are oleocanthal and hydroxytyrosol. Oleocanthal has been shown to exhibit anti-inflammatory activity through the same biological mechanism as ibuprofen, directly inhibiting the COX-1 and COX-2 inflammatory enzymes that drive chronic vascular inflammation. Hydroxytyrosol protects LDL cholesterol from oxidation, and this distinction is critical because it is oxidized LDL, not LDL itself, that initiates the immune response inside the artery wall that leads to plaque formation. Most importantly, multiple clinical studies have consistently demonstrated that regular consumption of extra virgin olive oil measurably improves endothelial function, meaning your blood vessels become more efficient at producing nitric oxide and responding to demands for increased blood flow. This improvement occurs throughout the entire circulatory network, including the small vessels whose diameter and flexibility matter most for male vitality. But olive oil alone does not reach its full potential without something most men have never thought to pair it with. The fermentation process that creates apple cider vinegar produces acetic acid as its primary active compound. Acetic acid does something very specific for vascular health. It slows the rate at which carbohydrates are absorbed following a meal by inhibiting digestive enzymes in the small intestine and slowing gastric emptying. Now, here is why this is a circulation topic, not just a blood sugar topic. When blood glucose remains consistently elevated over time, a pattern that becomes increasingly common as men age and insulin sensitivity naturally declines, a damaging process called glycation occurs. Sugar molecules attach to the structural proteins in your blood vessel walls, impairing their flexibility and function and directly accelerating the arterial stiffening I described earlier. Managing post-meal blood glucose is not just a concern for diabetics. It is a vascular health imperative for every man over 50. Beyond blood sugar, acetic acid also influences the renin-angiotensin system, the hormonal pathway governing blood pressure, and emerging research suggests it enhances the body's own production of nitric oxide, the same vasodilating molecule central to healthy endothelial function. There is also preliminary evidence that the organic acids in apple cider vinegar possess mild chelating properties that may support the body's natural processes for gradually reducing mineral deposits along arterial walls over time. When you consume extra virgin olive oil and apple cider vinegar together, in the correct ratio and prepared correctly, what happens inside your body is not simply the sum of two separate benefits. It is a genuine synergistic interaction. The acetic acid in the vinegar creates a mildly acidic digestive environment that measurably improves the absorption of the fat-soluble polyphenols in the olive oil. Those powerful compounds, oleocanthal and hydroxytyrosol, require an optimal digestive environment to cross the intestinal wall and enter your bloodstream. Without the vinegar, a meaningful portion of those protective compounds transits through without being absorbed. The vinegar is not optional. It is biologically necessary to unlock the full value of the olive oil. Additionally, the polyphenols from each source target different categories of cellular oxidative damage through distinct but complementary pathways, providing a broader protective shield than either substance alone. The anti-inflammatory effects of both substances appear to be genuinely synergistic. When researchers measure circulating inflammatory markers in individuals consuming both together versus individually, the combination consistently produces a greater reduction than either substance alone would mathematically predict. And finally, both ingredients support endothelial function through complementary mechanisms. The olive oil provides structural nourishment and antioxidant protection for the endothelial cells. The vinegar enhances their metabolic activity and signaling responsiveness. Together, they create the optimal conditions for your blood vessels to produce nitric oxide efficiently and respond appropriately to circulatory demands throughout the day. The preparation is simple, but the details are what separate an effective practice from one that delivers a fraction of its potential. Use the highest quality extra virgin olive oil you can find, stored in a dark glass bottle to protect the polyphenols from light degradation. More importantly, check the harvest date, not just the expiration date. Olive oil is not wine. You want oil harvested within the past 12 months. Freshly harvested, extra virgin olive oil contains polyphenol concentrations many times higher than oil that has been aging on a shelf. For the vinegar, choose raw, unfiltered apple cider vinegar. You should see a cloudy, web-like sediment at the bottom of the bottle. This is called the mother, and it confirms that the beneficial enzymes and naturally occurring bacteria produced during fermentation have been left intact. Clear, filtered vinegar is not the same product. The ratio is 3 parts olive oil to 1 part vinegar. For a daily amount, that means approximately 3 tablespoons of extra virgin olive oil combined with 1 teaspoon of raw apple cider vinegar. Pour the vinegar into a small bowl first, add a small pinch of sea salt, and whisk briefly. Then slowly drizzle in the olive oil while continuing to whisk. This creates a temporary emulsion, a blended mixture rather than 2 separate layers, which improves how your body processes and absorbs both substances simultaneously. For timing, consuming this mixture before or at the beginning of your largest meal produces the strongest blood sugar and metabolic benefit. Many men find that taking it in the morning on an empty stomach delivers the most noticeable impact on sustained energy throughout the day. And for men focused specifically on circulatory vitality, consuming it 60 to 90 minutes before physical activity may provide an additional acute benefit through enhanced nitric oxide availability. But the most important timing principle is this: consistency over weeks and months is what produces meaningful structural vascular change. Think of it exactly the way you think about physical training. One session does not build the body. Sustained, consistent practice does. In the first 2 to 3 weeks, changes are primarily internal. Digestion often improves, blood glucose levels begin to stabilize, and many men notice that the afternoon energy crash they had accepted as normal becomes significantly less severe. Between 1 and 2 months, more tangible vascular changes emerge. Blood pressure readings often show favorable movement. Many men describe a general sense of better circulation, feeling more warmth in their extremities, and noticing that their stamina during physical activity feels more sustained and less effortful. By the 3 to 6 month mark, men who have remained consistent commonly report meaningful improvements in intimate function and vitality. Erectile quality and reliability improve, not in the way a stimulant produces a temporary override, but in the way that genuine structural vascular improvement feels. The responsiveness that many men had quietly concluded was gone begins to return with a consistency that reflects real underlying biological change. A significant number of men come into my practice carrying a quiet resignation, a belief that declining energy, reduced vitality, and diminished intimate function are simply the price of getting older. I understand why they feel that way. No one told them otherwise. But your vascular system is not a deteriorating fixed structure. It is a living, adaptable system that responds meaningfully to the inputs you provide it. Start today. 3 tablespoons of high-quality extra virgin olive oil, 1 teaspoon of raw unfiltered apple cider vinegar. Whisk them together with a pinch of sea salt. Take it in the morning or before your main meal. Commit to at least 8 to 12 weeks of consistent daily use and pay honest attention to how your body responds. You have more control over this than you have been led to believe. Your body wants to heal. Give it the support it needs. If this video gave you a new perspective on your health, please hit the like button, subscribe to the channel, and leave a comment below. I read every single one. This video is for educational purposes only and does not constitute medical advice. Always consult your physician before making changes to your diet or health routine, especially if you have existing medical conditions or take prescription medications.